Hey everyone, this is Dr. Marcon, and this is chapter 20 on blood vessels. So what I'm going to do is I'm actually going to break up blood vessels into regions. I'm going to talk about the general characteristics of blood vessels, and then for this unit, I'm going to be talking about the blood supply to the head, neck, upper limb, as well as the thoracic region. And then the next unit, we'll talk about the blood supply to the abdomen as well as the lower limb. So we have three types of blood vessels that transport blood in the body. We have arteries, capillaries, and veins. So arteries carry blood away from the heart. And then we have arterioles. These are the smallest type of arteries. We have capillaries. These are the smallest blood vessels. And from the capillaries, we'll have venules. Venules will receive blood from capillaries, and then the veins will receive blood from the venules, and then these veins will transport blood back towards the heart. General structure of blood vessels, it is composed of three layers or tunics. The innermost layer is the tunica intima. The tunica intima is the innermost tunic, contains endothelium, which is made up of a simple squamous epithelium. And usually vessels that are greater than 1 millimeter will also have a sub-endothelial layer. So sub meaning below, so this is a layer below the endothelium. The second layer, this middle layer, is the tunica media. When you think tunica media, think middle muscular layer. The tunica media is made up of sheets of smooth muscle. Contraction of this muscle causes vasoconstriction. Relaxation of this layer causes vasodilation. Okay, and remember when we talked about what smooth muscle does and how it lines blood vessels as well as the hollow organs of the body. The outermost layer is the tunica externa, also known as the tunica adventitia. This layer is composed of connective tissue. And finally, we have a centralized space called the lumen. The lumen is a central blood-filled space of a blood vessel. And here we see the generalized structures of arteries, veins, and capillaries. So arteries, again, being the blood vessels that carry blood away from the heart. We see the three layers. We see the tunica intima with the innermost layer, the endothelium. Below that layer is that subendothelial layer. And then around that would be the internal elastic membrane. The tunica media is made up of smooth muscle as well as elastic fibers that we talked about in Unit 1. There's an external elastic membrane, and then finally an outermost tunica externa, or tunica adventitia, made up of collagen fibers. We then have a blood supply, or the vasovasorium layer of these blood vessels. And of course, there's that centralized space called the lumen. Now, both arteries and veins do have the same generalized structure. However, there are distinct differences between arteries and veins, which we'll get into. One of the most distinctive differences, of course, is the thickness of that tunica media, that middle muscular layer. We know that arteries have a thicker tunica media. Also, another main difference is that some veins do have valves within their lumen, and these valves help prevent the backflow of blood. So then we get down to the capillaries being the smallest vessels, and they're usually made up of one layer of endothelium, and they're very porous, meaning they allow for cells to go through, also allow for gas exchange. So here we see arteries usually carrying oxygenated blood away from the heart to the rest of the system, and then down to the capillary level where we'll have gas exchange, and then deoxygenated blood goes into the venules, and then into the veins to carry deoxygenated blood or carbon dioxide rich blood back to the heart. Here we see a slide of a typical artery and vein. Again, we can see that distinctive tunica media, that very thick tunica media within an artery, a lot thicker compared to the thinner walled vein. And if you get to actually handle cadaver sections, you'll feel that arteries are a lot springier, a lot kind of thicker compared to the thinner walled veins. Now we have different types of arteries. The largest arteries are called elastic arteries, and they range in diameter from 2.5 centimeter to 1 centimeter. This includes the aorta. We know the aorta is one of the largest arteries that carries blood away from the heart. So the aorta and its major branches are examples of elastic arteries. These are sometimes called conducting arteries. And these types of arteries have a very high elastin content, so a high amount of elastic connective tissue that helps dampen that surge of blood pressure and kind of gives the artery that recoil characteristic to allow for the pumping of blood to the rest of the system. So we see this familiar slide. We see the layers, the different layers of an elastic artery. Particularly, this could be the aorta. This is the aorta, actually. So we have that centralized lumen. We have that innermost layer, which is the tunica intima, and then this very thick middle muscular layer. This is the tunica media with a high elastin content, and then the outermost layer being the tunica externa, made up of connective tissue, also called the tunica adventitia. The next type of artery are the muscular or distributing arteries. These arteries actually lie distal to the elastic arteries, and their diameters range from 1 centimeter to 0.3 millimeters. These include most named arteries. Like most arteries, the tunica media is thick. Some unique features about the muscular or distributing arteries, they have an internal and external elastic laminae. So the internal elastic laminae forms the outer layer of the tunica intima, while the external elastic membrane or external elastic laminae forms the outer layer of the tunica media. Again, these elastic membranes, in addition to the elastin found within the tunica media, will help to dampen that pulsatile pressure produced by the heartbeat. And on this next slide, we can see an example of muscular or distributing artery. Again, we have the lumen and we have the tunica intima, and that tunica intima has an outer layer of the internal elastic membrane. We have this thick tunica media that contains the elastin fibers, also that middle muscular layer, and external to that layer we have an external elastic membrane, and here we see the outermost layer, that tunica externa or tunica adventitia. Arterioles are the smallest of the arteries. Their diameters range from 0.3 millimeters to 10 micrometers. The larger arterioles possess all three layers or all three tunics, and the diameter of arterioles is controlled by local factors in the tissues, as well as the sympathetic nervous system, that fight or flight response. And here we see small arterioles, some containing all three layers. Usually the larger ones contain all three layers. So we can see the lumen, we see that inner tunica intima made up of endothelium, and we see that middle layer, the tunica media, and then the outermost layer, the tunica externa. Now, capillaries are the smallest blood vessels. Their diameter ranges anywhere from 8 to 10 micrometers or microns, and usually just large enough for red blood cells to pass through in a single file. Now, we have site-specific functions of capillaries. For example, capillary network in the lungs. This is where oxygen enters blood. We have diffusion exchange of gases, so oxygen will enter the blood, whereas carbon dioxide will leave the blood so that it can be exhaled out by the lungs. Within the small intestines, capillaries are important because they receive digested nutrients. When we break down our food into smaller molecules, these capillaries that will receive the smaller molecules to be transported to our tissues. Within the endocrine glands, our capillaries help pick up hormones that are secreted by endocrine glands. In the kidneys, the capillaries are responsible for removal of nitrogenous waste products formed by the kidneys. And here we see a capillary whose diameter is just large enough for red blood cells to kind of pass through in a single file. We have different types of capillaries. We have continuous capillaries. This is the most common type of capillary that occurs in most organs. We have tight junctions and desmosomes that help join epithelial cells. We also have intercellular clefts, and these are gaps of unjoined membranes that allow small molecules in and out of capillaries. So here we see a continuous capillary. It's the least permeable of the capillaries, but is the most common. So here we see the different structures that make up the continuous capillary. We have the intercellular clefts between the endothelial cells, and we have tight junctions between these cells, and we can see within the lumen of the capillary a red blood cell. Fenestrated capillaries, these are capillaries that are joined by tight junctions and desmosomes. They have pores in their endotheliums, pores to allow molecules to pass through or gases to pass through. So fenestrated capillaries occur where high rates of exchange occur, for example, in the intestines, with the exchange of digested nutrients, the glomeruli of kidneys, where we have capillaries that help receive nitrogenous waste products, and then endocrine glands, where we have secretion of hormones. So here we see a fenestrated capillary. Again, we have large fenestration, also known as pores. We can see these pores between the endothelial cells to help increase permeability of molecules or gases. So occurs in areas of active absorption or filtration, such as the kidney and small intestine. Now, sinusoids are wide, leaky capillaries found in some organs and are usually porous or fenestrated. The intercellular clefts are wide open, and these occur in bone marrow and spleen. We heard about sinusoids in the spleen before, so sinusoids have a large diameter and a twisted course. So here we see large endothelial clefts or intercellular clefts between the endothelial cells. And again, they are joined by tight junctions, and we can see that there is a bit of an incomplete basement membrane, so very large and porous. And these are the most permeable and occurs in special locations such as the liver, the bone marrow, and the spleen. So with regards to permeability, there are 4 routes into and out of capillaries. We have direct diffusion of molecules. We also have routes through the intercellular clefts, those spaces between the endothelial cells. We also have permeability through cytoplasmic vesicles, and then through pores or fenestrations. Now we have areas that have capillaries that are of low permeability, specifically the blood-brain barrier. Within the blood-brain barrier, capillaries have complete tight junctions, and there are no intercellular clefts present. And only the vital molecules can pass through, so it's a very highly selective transport mechanism. However, does not provide a barrier against oxygen, carbon dioxide, which is important for gas exchange, and some anesthetics, so some anesthesias that provide that numb feeling so that we could perform surgery or some sort of procedure without harming our patient or causing our patient pain. Capillary beds are a network of capillaries running through tissues. We have structures called precapillary sphincters that help regulate the flow of blood into the tissues. We know that structures such as tendons and ligaments are poorly vascularized, and even epithelium and cartilage are avascular, meaning they don't have their own blood supply, but instead receive nutrients from nearby connective tissue. So here is an example of an anatomy bed. We can see where gas exchange occurs. So the capillaries deliver oxygen to the tissues, and then the distal end of the capillary bed will receive carbon dioxide, will exchange the carbon dioxide, and then transport the deoxygenated blood to the venules and then to the veins. But again, we do have these structures called precapillary sphincters that kind of regulate the flow, the blood flow through the capillaries. So here we can see a terminal arteriole feeding into the capillary bed, bringing oxygenated blood to the capillary bed. And then we have the post-capillary venule, which will carry deoxygenated blood away from the capillary bed. So almost all tissues contain these capillary beds that again allow for the delivery of oxygen to tissues, and then the carrying away of waste products as well as carbon dioxide away from tissues to go back towards the heart. When we have relaxation of these precapillary sphincters, we can see blood passing through all the capillaries within this capillary bed. So we have, the true capillaries that allow for that gas exchange of oxygen and then carbon dioxide. However, when these precapillary sphincters close or tighten, there's only blood flow that goes through this structure called the met arteriole. So it actually bypasses the true capillaries within the capillary bed. And this occurs when the tissue has lower oxygen demands, such as when nearby tissue cells already have adequate oxygen. So the precapillary sphincters will close off the true capillaries and force the blood through that met arteriole again, and flow straight through into the thoroughfare channel and then into the postcapillary venule. So now we're going to talk about venous vessels. Venous vessels, so veins, the definition, basically they conduct blood from the capillaries toward the heart. Blood pressure is much lower in veins compared to arteries. We talked about venules being the first vein that kind of receives blood from the capillary bed. So we have venules that are the smallest veins, and their diameters can range anywhere from 8 to 100 microns or micrometers. The smallest venules we talked about are called post-capillary venules, and the venules will eventually join to form larger veins. Veins, we talked about having structural differences compared to arteries. Their lumens, the space within the blood vessel or within the vein, are a lot larger compared to arteries. 65% of blood that we have in our bodies are contained in the veins at any given time. We know that the tunica externa, that outermost layer, is actually thicker compared to arteries. But we also know that veins have less elastin in their walls, and these walls are thinner compared to the arteries. And this table in your book, table 20.1, just basically is a summary of the anatomy of blood vessels, and it compares the average lumen diameter and wall thickness of the different types of vessels, and then it'll show you the relative tissue makeup within the endothelium, elastic tissues, smooth muscles, as well as fibrous collagenous tissues. So I would definitely, just to kind of summarize the general characteristics of the blood vessels that we talked about in the previous slides, use this table to study. So here we see elastic artery, the largest of the arteries, and then going down to the muscular artery and the different characteristics of the two. And then we have arterioles and capillaries. Then we'll have the venules, the smallest of the veins, and the smallest one we talked about was the postcapillary venule, receiving deoxygenated blood from the capillary bed, which will then feed into veins. So we can see distinct differences of the tissue makeup between veins and arteries. So make sure you study this table to kind of get an idea of the different characteristics. Now we have specific mechanisms to help counteract low venous pressure within veins. We have structures called valves, and valves are not contained in all veins, but they are contained in some veins, particularly in the limbs. Valves help prevent backflow of blood. Valves are not located in the veins of the thoracic and abdominal cavities. We also have the skeletal muscle pump. So our muscles press against the thin-walled veins to help allow for the flow of blood. And we can actually see it in this next slide. We can see how the contraction of skeletal muscle kind of pushes the blood through our veins. And we can see that the valves will help prevent the backflow of blood. So vessels will interconnect to form vascular anastomoses. Anastomoses are just connections between these vessels. Organs will receive blood from more than one arterial source. We'll have neighboring arteries that form an arterial anastomosis, which helps provide collateral channels. So if we have tissue that has a blood supply, it will have a main artery that gives its blood supply. However, we'll have collateral arteries that also help give blood supply to that tissue, so that if we have one of the arteries kind of cut off, we'll have other arteries also kind of making up for that cut off artery to provide additional blood supply to that tissue. So provide collateral channels is one of the characteristics of arterial anastomoses. Veins will anastomose more frequently than arteries. So we talked about the pulmonary circulation. The first great vessel that we talked about is the pulmonary trunk. We know the pulmonary trunk is that a large vessel that will leave the right ventricle, and the blood has to pass through the pulmonary semilunar valves. The pulmonary trunk will divide into right and left pulmonary arteries. Again, these pulmonary arteries are the only arteries in the body that transport deoxygenated blood, or oxygen-poor blood. But it still fits the definition of an artery in which these are vessels that carry blood away from the heart. So from the pulmonary arteries, blood will be transported to the lungs, where it will get reoxygenated. We'll have gas exchange occurring at the capillary level, and then the reoxygenated blood will be transported to the superior and inferior pulmonary veins on the right and left side. These structures, these vessels, will carry oxygenated blood back to the heart via the left atrium. The vessels of the pulmonary circuit, they have thinner walls compared to systemic vessels. And the max arterial pressure is lower in the pulmonary circuit. So they have thinner walls to allow for maximum gas exchange, and we can actually see that in this next slide. And we'll talk more about this when we get to the respiratory system. So we see that the smallest structures within the lungs are alveoli. These are sort of like sac-like structures that look like kind of grape clusters, and they're very thin-walled. and we can see gas exchange occurring between the alveoli and the pulmonary capillaries. So carbon dioxide is exchanged for oxygen. Carbon dioxide will travel back into the alveoli, whereas oxygen will travel into the pulmonary capillary. Again, this gas exchange allows for the exhalation of carbon dioxide and the inhalation of oxygen to be transported to the tissues of the body, the tissues and organs of our body. Now, with the systemic circulation, again, we have systemic arteries that will carry oxygenated blood away from the heart. We know that the aorta is the largest artery in the body, and the aorta receives blood from the left ventricle. So here we see a diagram of the major arteries of the systemic circulation. We can see that from the heart, blood will be pumped from the left ventricle to the aorta to go to the rest of the body. The branches of the aortic arch giving blood supply to the head, neck, and the upper limbs, and then the descending aorta or the thoracic aorta giving blood supply to the thoracic structures. And then once it passes through that diaphragm, that muscle that separates the thorax from the abdomen, it becomes the abdominal aorta, which will then give blood supply to organs with the abdomen, and then bifurcate into the iliac arteries, the common iliac arteries right and left, giving blood supply to the structures within the pelvis. And then once it passes that inguinal canal, it becomes the femoral artery, all the way down to the tibular and fibular arteries, as well as the arteries within the foot, so giving blood supply to the lower limbs. That's the basic general idea. And we're going to break these down, break the arteries and the veins down into regions so we can get a better sense of the specific blood supply of the different parts of the body. But this very small structure, or very small diagram, which you'll also find in your book, are actually arteries that we use to palpate a pulse. So here we'll have pulse points within our body. So within our head, we have that superficial temporal artery where we can get a temporal pulse. We have the facial artery located kind of anterior to the ear. One of the most common pulse points is the common carotid artery within the neck. When we are doing or performing CPR, we want to get a pulse within the neck, and we are palpating the common carotid artery. Another artery that's very important is the brachial artery. When we are taking blood pressure with our sphygmomanometers, this is the artery that is occluded when we are pumping up our sphygmomanometers and then releasing the valve to hear the blood rushing back into this artery, the brachial artery, to obtain a blood pressure amount, our systolic and diastolic blood pressure. And then our radial artery, which we find at the base of the thumb, also important for taking heart rate. Another important artery is the femoral artery, which we can find in the inguinal region, or the top part of the thigh. The popliteal artery, right behind our knee. This can be palpated also to find a pulse. If we have, for example, a patient that is an amputee that doesn't have any arms, and we want to palpate a pulse within their lower limbs, we can find it in the popliteal artery. Also, the posterior tibial artery is an artery that we can find a pulse, and more common is the dorsalis pedis artery, this artery that we can find at the dorsum of the foot, or the top part of our foot. So these are very important pulse points to know, especially if you are going into any healthcare related field. So first we're going to start talking about the blood vessels within the thorax, specifically the blood vessels coming from the heart. We have the aorta, one of the largest arteries in the body. And we have different parts of the aorta. The first part of the aorta is the ascending aorta. The ascending aorta arises from the left ventricle, so blood coming from the left ventricle has to go through the aortic semilunar valve to be transported to this first part of the aorta, which is the ascending aorta. Now, the ascending aorta is important because we have branches of our coronary arteries coming from this first section, and the coronary arteries provide blood supply to the heart itself. From the ascending aorta, it becomes the aortic arch. The aortic arch lies posterior to the manubrium of the sternum and has three very important branches. On the first branch, I usually like to call it the right brachiocephalic trunk. The right brachiocephalic trunk because it gives blood supply to the right side of the head and neck as well as the right upper limb. So the right brachiocephalic trunk is the first branch, and eventually it will branch off to form the right common carotid artery as well as the right subclavian artery. And again, giving blood supply to the right side of the head and neck and the right upper limb. The second branch is the left common carotid artery. So the left common carotid artery will give blood supply eventually to the left side of the head and neck. The third branch coming off of the aortic arch is the left subclavian artery. The left subclavian artery will then give blood supply to the left upper limb. And here is a diagram of the heart showing the aorta, which is the largest artery in the body. And the first part being the ascending artery, and we can see here the branches of the ascending artery. We have the right coronary artery going through that coronary sulcus, and then kind of going posterior to the pulmonary trunk, we have the left coronary artery and its two branches, the left anterior descending artery and the circumflex artery here. The ascending aorta will then become the aortic arch with its three branches. We have the right brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The descending aorta is the section of the aorta after the aortic arch, continues from the aortic arch, and it is also synonymous with the thoracic aorta in the thorax. So the thoracic aorta is in the region of T5 to T12, so vertebrae T5 to T12. Once it goes through the diaphragm, again, that muscle that separates the thorax from the abdomen, it becomes the abdominal aorta. The abdominal aorta will end at L4. At L4, the abdominal aorta will then divide or bifurcate into right and left common iliac arteries. Okay, so that is the basic structure of the aorta coming from the heart, specifically the left ventricle of the heart. We'll then get into the arteries of the head and neck. We have pairs of arteries supplying the head and neck. We have the carotid arteries, which are branches of the aortic arch, the right common carotid artery coming from the right brachiocephalic trunk, and then the left common carotid artery coming from as the second branch off of the aortic arch. And then we also have branches of the subclavian arteries. We have the vertebral arteries that we talked about when we were going over bones. These arteries go through the transverse foramen within the transverse processes of the cervical vertebrae. We also have branches of the subclavian arteries that include the Thyrocervical trunk, giving blood supply to the neck region around the thyroid gland, and the Costocervical trunk, which we'll see in the next diagram. So here are arteries of the head and neck. We see branches of the subclavian artery. We have the vertebral artery, again, going through the transverse foramen of the cervical vertebrae, which will eventually go into the base of the skull to help contribute to the circle of Willis. We have the Thyrocervical trunk and the Costocervical trunk, again, giving blood supply to the head and neck. We can see that the common carotid artery will eventually branch to form the external carotid artery. as well as the internal carotid artery. Internal carotid artery, again, going into that carotid canal in the base of the skull to help contribute to the circle of Willis, which is the blood supply of the brain. So the common carotid arteries are located in the anterior triangle of the neck. The two branches of the common carotid artery that we talked about are the external carotid artery as well as the internal carotid artery. So we have right and left common carotid arteries as well as right and left external and internal carotid arteries. And here are the branches of the external carotid artery giving blood supply to the external part of the head and neck. So we have the superior thyroid artery, the lingual artery, facial artery, occipital artery, posterior auricular, so posterior auricular behind the ear, superficial temporal artery, that's that one artery that we can find at the temple of the head around the frontal bone, that where we can palpate a pulse point. Also an important artery because when we do one of those sliding thermometers, it kind of goes over that superficial temporal artery to give a temperature of a patient. And then the maxillary artery. The internal carotid artery has the ophthalmic artery giving blood supply to the eyes, anterior cerebral artery giving blood supply to the anterior part of the brain, anterior communicating artery help form the cerebral arterial circle or the circle of Willis, and the middle cerebral artery. So that's it for the carotid arteries. The subclavian arteries, we know that the right subclavian artery originates from the brachiocephalic trunk. The left subclavian artery is the third branch off of the aortic arch. The vertebral arteries, a branch of the subclavian artery, supplies the posterior brain. The vertebral arteries will join to form the basilar artery. The basilar artery will then divide into two posterior cerebral arteries and then join to form the posterior communicating arteries that connect the posterior cerebral arteries to the middle cerebral arteries. These arteries contributing to the circle of Willis, which we'll see in the next slide. So here we see the circle of Willis. The circle of Willis, we can see the two vertebral arteries coming up from the cervical vertebrae. They will join together to form this basilar artery here, which will then kind of bifurcate to form the posterior cerebral arteries, giving blood supply to the posterior part of the brain. And then coming off the posterior cerebral arteries are the posterior communicating arteries, which will join with the internal carotid artery here, and then form the anterior cerebral artery here, going towards the anterior part of the brain. And then between the anterior cerebral artery, we have an anterior communicating artery. So these arteries forming that circle of Willis, also known as the cerebral arterial circle, giving blood supply to the different parts of the brain. So with regards to branches of the subclavian artery, we have the thyrocervical trunk. These send two branches posteriorly over the scapula, sends one branch anteriorly to the inferior part of the thyroid gland, which is located in the anterior part of the neck. The costocervical trunk sends a branch superiorly to the deep muscles of the neck. Also will send a branch inferiorly to the intercostal spaces. So that is the blood supply to the going to the head and neck. Now we're going to talk about the arteries of the thorax. We have the internal thoracic arteries that supply the anterior thoracic walls. We have the anterior intercostal arteries. So intercostal means between the ribs. These are branches of the internal thoracic arteries. And we have posterior intercostal arteries, giving blood supply to the inferior 9 pairs. I'm sorry, not giving blood supply, but the inferior 9 pairs will arise from the thoracic aorta. So moving on to the arteries of the upper limb. The subclavian artery. On the right, the subclavian artery is a branch of the right brachiocephalic trunk. On the left, the subclavian artery is a direct branch coming off of the aortic arch. It's the third branch. So the subclavian artery will enter the axilla as the axillary artery. So a border that I like to use to kind of help you determine when the subclavian artery turns into the axillary artery is the inferior border of the first rib. So once the subclavian artery passes by the inferior border of the first rib, it becomes the axillary artery, which you'll find basically in your armpit area. The axillary artery becomes the brachial artery at the inferior border of teres major. Teres major is a muscle in the back. So that forms the border between the axillary artery and the brachial artery. So once the axillary artery passes that inferior border of teres major, it becomes the brachial artery. The brachial artery will then divide into the radial artery laterally and the ulnar artery medially. So here we see that subclavian artery coming from the right brachiocephalic trunk. It'll pass by the inferior border of the first rib, become the axillary artery. Once the axillary artery passes that inferior border of the teres major muscle, it will then become the brachial artery. So here's that brachial artery. The brachial artery will then bifurcate to form the radial artery, which is located laterally to the arm, and then the ulnar artery, which is located medially. Again, that radial artery important as an important pulse point, so we can get the heart rate and locate it at the base of the thumb. And then the radial and ulnar artery will then kind of form this arch, giving blood supply to the hand. So we have a deep palmar arch as well as a superficial palmar arch, and the digital arteries will come off those arches, giving blood supply to the fingers of the hand. So now that we've talked about the arteries and the arterial supply of the thorax, the head, neck, and the upper limb, we're going to talk about the veins. So with regards to systemic veins, we have three major veins that enter the right atrium. We talked about the superior vena cava, the inferior vena cava, as well as the coronary sinus. The coronary sinus, of course, draining deoxygenated blood from the heart itself. Now, all medium and large arteries have deep locations accompanied by deep veins. And then the superficial veins will lie just beneath the skin. We'll have multi-vein bundles, also known as venous plexuses. And also we have unusual patterns of venous drainage that we can find in the dural sinuses as well as the hepatic portal system. So major veins, we have the superior vena cava that returns blood from body regions superior to the diaphragm. We have the inferior vena cava that returns blood from the body regions below or inferior to the diaphragm. And the superior and inferior vena cava will drain all their blood into that first chamber on the right side of the heart, which is the right atrium. And here we see the major veins of the systemic circulation. Remember, all these veins are draining blood away from the limbs, going back towards the heart. So we have our veins of the lower limb going up the leg, going up the iliac veins, the common iliac veins, abdominal, which is the inferior vena cava, going through hepatic circulation, hepatic portal system, also the veins draining from the upper limbs, and also the dural venous sinuses, and draining into the veins of the head and neck, all going into the superior vena cava. And we'll break this down into the different regions. So with regards to the veins of the head and neck, we have within the brain the dural sinuses. Major veins of the dural sinuses include the superior and inferior sagittal sinuses, the straight sinus, the transverse sinuses, and the sigmoid sinuses. So all these sinuses are draining blood away from the brain. And most of these are located within the dura mater, which is the outermost makes up the outermost of the meninges that cover the brain. So here we can see that superior sagittal sinus, obviously sitting within that sagittal plane. We have the inferior sagittal sinus. We have the cavernous sinus, the straight sinus. We have our transverse sinuses, cavernous sinus located here. We have a confluence of sinuses, so joining together of sinuses. And then all these sinuses will then drain into the internal jugular vein that passes through the jugular foramen located at the base of the skull. So the internal jugular vein will then eventually drain into and join up with the subclavian vein to then form the brachiocephalic vein. So the internal jugular veins drain blood from the brain. Superiorly, it lies lateral to the internal carotid artery. Inferiorly, it will lie lateral to the common carotid artery. The external jugular veins are tributaries that drain the scalp and again will empty into the subclavian vein. And if you actually look at an anterior view of the neck, we'll see that the external jugular vein is more lateral compared to the medially located internal jugular vein. So here we see veins of the head and neck. We can see the external jugular vein draining blood from the scalp as well as structures of the face. We can see the internal jugular vein draining the dural sinuses of the brain. And then these, the external jugular vein and the internal jugular vein will then meet up with the the external jugular vein here drains into the subclavian vein, and we see branches of the internal jugular vein that will then join up with the subclavian vein to form the brachiocephalic vein. Also, we'll see a vertebral brain that accompanies the vertebral artery going through the transverse foramen of the transverse processes of the cervical vertebrae. Okay, so all these structures draining the deoxygenated blood of the head and neck. The external jugular vein draining directly into subclavian vein, the internal jugular vein meeting up with the subclavian vein to form the brachiocephalic vein, which will then drain into the superior vena cava. Veins of the thorax draining the thoracic structures include the zygos vein, the hemiazygous vein, as well as the accessory hemiazygous vein. Now, veins of the upper limbs. The deep veins will follow the paths of the companion arteries and will have the same names as the companion arteries. Superficial veins are visible beneath the skin, and this includes the cephalic vein, basilic vein, the median cubital vein, and the median vein of the forearm. So here we see a diagram of the veins, both of the thorax and upper limb. So within the thorax, we can see the azygous vein here draining into the superior vena cava. We have our hemiazygous vein located here within the thorax, as well as our accessory hemiazygous veins. Again, anything above the diaphragm draining usually into the superior vena cava. Now, we see the internal jugular vein, that larger, more medial vein, and then the external jugular vein draining into the subclavian vein directly, and then the internal jugular vein will join with the subclavian vein to form the brachiocephalic veins. Okay? Now, let's start distally and go proximately. So veins of the hand, we have our digital veins, which will drain into the superficial palmar venous arch. We also have a deep palmar venous arch. The deeper veins include the radial vein, located laterally along the radius, and then we have the ulnar vein, located along more medially. Along the ulna. Superficial veins that we'll see more laterally, we have the cephalic vein here, and then more medially we have the basilic vein here, And then we have that median vein of the forearm located here. The median vein of the forearm will drain into the basilic vein. And then we have a communication. This median cubital vein within our elbow, our cubital fossa, this vein is very important because we use this vein to do our blood draws, or we can even administer intravenous fluids. So again, the cephalic vein will actually travel more laterally. It travels through this sort of groove between the deltoid and the pectoralis muscle. And then so that's more laterally. More medially, we'll have the basilic vein. The brachial vein that accompanies the brachial artery will actually join into the basilic vein, and then the basilic vein and the cephalic vein will form the subclavian vein, which will then drain into the brachiocephalic vein, and then the superior vena cava, and then back to the right atrium. So superficial veins form anastomoses. Frequently, again, we have that median cubital vein, which is used for blood draws to obtain blood or administer intravenous fluids, IV fluids. When I taught medical assisting, I had to teach my students how to do the blood draws and how to palpate that median cubital vein. And you can actually see when we place a tourniquet, we can see the veins within that cubital fossa. So, and there are different variations of the medial cubital vein. Once the tourniquet is placed properly, this allows for the pooling of blood within the veins to allow them to kind of pop out and allow us to do our blood draws. So we have that medial cubital vein within that cubital fossa. More laterally will be the cephalic vein, and then more medially will be the basilic vein. So we can see a surface view of the right upper limb, and then cadaver section, again, will have that medial cubital vein within the cubital fossa, and then more laterally will be the cephalic vein, and more medially will be the basilic vein here. And those are that's the blood supply and the blood vessels of the thorax, the head, neck, and the upper limb.